want to show our viewers,
Sure.
if we may, some symptoms where this might be something that you're going through, and maybe that's why they need to see you, for example. Let's talk about those. Let's go from left to right, if you will, clockwise.
Clockwise, well, there's not at the top.
Nausea,
nausea and vomiting. Very common. That's again when we discussed earlier about the gallstone getting stuck in the neck of the gallbladder. That's where you get the acute attack. It can definitely cause nausea after eating. The belching is seen because you're not digesting the fat appropriately. It's not going down very easily. The jaundice is seen with patients where actually a gallstone will get out of the gallbladder into that duct, which is the highway, the common bile duct between the gallbladder and the intestine, and that blocks that up. So then all the flow coming out of the liver gets backed up, and then the bile, which is brown, will be excreted in your urine, and it's seen in the skin, and that's where people get jaundice. If they get elevated body temperature, this usually means they have signs of acute infection of the gallbladder. Flatulence, that's always a very interesting one. What happens there is that since you're not digesting all of your bile, all of your fat, because you don't have enough bile because it's not coming out fast enough, what happens is that the bacteria in your colon that we all have, about 1 billion of them, they will eat anything that you don't have, that you haven't eaten, and they will basically make wonderful gas that is wonderfully smelling, and you'll have a lot of diarrhea from that.
And that's very wonderful.
Yes, it is.
Thank you for that adjective. Go ahead.
Well, it helps people remember.
Let's keep on with the last couple. Pain in the, I missed actually, pain in the right hypochondrium.
So yeah, in the right upper quadrant, that's what we were discussing. I put my hand there a couple of times. That's where it'll be, or women will feel like underneath the right breast. And then weakness in general usually is a more difficult problem, which could be many other medical issues. It's just the gallbladder is one of them.
And then heartburn, of course.
Of course.